and I'm here with my bubs. Jack, say hi. He's trying to get away. I'm a San Diego State University nursing senior student. Woo, the end is near. No, I've truly had such an incredible experience in nursing school. So yeah, let's get right into it. You've been accepted into nursing school. You're ready to start this journey in college, which is really exciting. But it's definitely, we all know it's a huge transition, right? So I wanted to give you some tips or some advice that I have learned that I wish I knew going into school. So my first piece of advice for you is to get involved. So you're probably living in the dorms, you know, you're freshmen starting off school, you're all clustered in this place where there's so much sensory overload. You're like, what's going on? And maybe you don't have very many friends right now. You're starting off. So how you find those friends is getting involved. I'm involved in SNA, the Student Nurses Association, which is really cool, but it's also related to my major, and I wish I had done another club maybe additionally that was more of a hobby. So finding things that interest you, like a lot of colleges have so many clubs. There's so many. Like SDSU, I know we have intramural sports of almost every kind that you could imagine. There's improv and comedy clubs. There's probably a chess club. We even have, I'm pretty sure, a cabbage or lettuce loving / eating club. So, I mean, you can find your niche for sure. Your niche. You can find it. And yeah, it's a great way to find like-minded people who are interested in similar things to you. You'll probably make lasting friendships that way. So that's a good start. All right, now tip 2. Give yourself time to adequately prepare for class and clinical. This is something that I wish I would have done better, honestly. But it's truly really important. So just putting in the work in advance for your classes, retaining that information, working on, getting it filed in your brain, and even more so for clinical, because you might be put on the spot a little bit more in clinical, potentially, not always, but sometimes you'll work with a nurse preceptor who's going to be asking you questions, who's going to be making sure that you're involved and that you know what's going on. And it's okay if you don't know everything. I mean, I feel like I still know very little, but I mean, I'm learning like constantly. In nursing, you're constantly learning. So just really putting in the work to get to learn the material is so, so important. And I highly recommend doing that. All right, now on to my third piece of advice. Always give your all in clinical to show the nurse that you're there to help, and you're there to learn. This is important because, these nurses are working excruciating 12-hour-long shifts. And you don't want to be just dead weight added onto their day. You want to be as involved as you can, asking, what can I do? How can I help you? And if you have a specific question about a patient, a disease process, some, pathology, a specific type of medication, go ahead and ask them. They want to know, generally speaking, unless they're very super busy, and maybe not in a good mood, they want to know that Jack says hi. Here's my baby. That you're there to help them and that you want to be a nurse, and it'll just make their day and your day too go a lot faster if you do engage with them. So I recommend that. And some nurses, not all of them, will put you on the spot and ask you questions and stuff. So sometimes you might be forced to be engaged. So it's better to just right off the bat, just be engaged yourself. So my fourth tip, and this one's really important, is to thank your professors, thank your clinical instructors, and thank your preceptors. These people are all here, they're on your team, they're rooting for you, and they really do want you to succeed. With professors, inevitably, like anything, you're gonna have some that are better than others. Some will be okay, and some will be incredible, arguably life-changing. And, you know, there'll be people, some of them will be professors and instructors that you remember forever and how they influenced you. So even if they aren't the best, they're working for you, and you want to, regardless of where they stand, you want to thank them, you know, at the end of the semester or during, if there's an appropriate time. You can send them an email, write them a letter, just go up and say, listen, thank you, I appreciate all that you're doing. Just because that is something that I think validates them and makes them feel good, and then makes it feel like their work is meaningful. So keep that in mind. All right, my fifth piece of advice, which basically can be summed up in this poster I have: be kind, be kind, be kind, be kind, be kind. It's be nice, you know, be nice to your classmates, be nice to your professors and the people you're working with. Obviously be nice to your patients. Be nice to, yeah, be kind to everyone. You know, everyone, especially the classmates, you guys are all in the same boat. You're struggling together. You guys are in the trenches together, so you want to be kind and not hurtful to any of those people. And then, you know, if you ever get stuck and you're in a rut and you need help, they'll be more willing to help you out if you were kind to them. And if someone's kind to you, you'll probably be more inclined to help them as well. I mean, everyone's in the same boat, struggling together. We all need help sometimes, so don't be afraid to ask for it if you need it. And really working to maintain a friendly environment in your nursing school, because I've heard of some programs or some places, some schools, some students feel that it's a really cutthroat, high intensity place, and it just honestly doesn't have to be that way. So be there for each other, and that's such a huge, honestly, a huge piece of advice I recommend following. And my final piece of advice is to maintain your hobbies in school. You know, work is hard, school is hard. It's kind of gonna suck your energy out a little bit at times, and so you need to do things that I say fill your tank, basically. For me, I really like, well, I wouldn't have said this 2 or 3 years ago, but I really like reading. That's something I've kind of picked up and been interested in. I also really like different mediums of art, media of art. This is something I got into, embroidery. This is my most recent project. It's been a lot of fun. But just doing things that maintain your happiness, ultimately. It's so important to, yeah, fill your tank and basically keep that energy going strong. So do that. So that concludes my video. Sorry it was long. I like to talk a lot. But thank you for watching, and I really, you know, congratulations on being accepted in nursing school. That is a huge accomplishment in itself. You know, you'll go through trials and tribulations. It's gonna be ups and downs, just like in life, but hang in there, okay? You can do it. We're all rooting for you, and just do your best and be your best. Congratulations. Thank you.